Hello everyone, I hope you're all well. My name is Naman. I'm a doctor working in the UK for the last 2 years. I started my GP training this year, and this is a video that I wanted to have when I was working as a trust grade doctor, and I always used to wonder that how GPs on earth can see a patient in 10 minutes. So I've made a video on a test patient when I was working in my clinic, and I'll walk you through how it actually looks like when you are in the clinical setting and you are actually working as a GP trainee. For the new trainees, I just want to say that you'll hear a lot of things around that GP is very stressful. This is the most exhausting specialty. The highest burnout is among the GPs, and it's very difficult, it's very tough. You see a patient in 10 minutes, it's not very safe, etc, etc. A lot of that can be true, but I want to say is that it's not because of the specialty itself, it's because of the NHS. NHS is overstretched, overworked, underfunded, and all those things that we hear on media. That's true. It's not just GP. You go to A&E, there is a 12 hours wait time. It's because of the system that's actually unable to cope. So don't think it's the problem with the specialty, it's the problem with the health system, and we can just hope that it will get better. Training itself is very protected. Opportunities are enormous once you CCT, and I'll make a detailed video about the pros and cons of becoming a GP. So make sure you subscribe the channel so you can see it when I'll upload it. So yeah, let's get into it. Hi guys, just making a video to show that how we work in a GP setting. If you are a new GP trainee and you're about to start your first GP rotation, it can be super helpful. I'm just gonna talk you through how the system works. It's system 1, and what are the important tabs that can you open on Google that can be super helpful for you to improve your workflow. So this is system 1. So this is a test patient. It's Mickey Mouse, so it's not a real patient. So when you open a patient, you normally get the details here, and then you get a visual representation of the condition they have. For example, this heart shows they have CHD, this kidney shows they have chronic kidney disease. If you go to this D, that shows they have diabetes, and if you go to this bone, that shows osteoporosis. And then here is the red alert. So you click here, you'll see if there are any allergies, and also you get some alerts, so it's good to just glance through them. The good thing in GP is that you don't need to clerk in detail like in hospital. You don't need to go through full family history, full past medical history, all the medications. Everything is already there, so you just deal the problem to the point and just let the patient go. For example, so here in this tab, if you see, you already know what medications the patient is taking, so you don't need to dig much into it. And also if you go here, the problems, major or minor problems, you already see here. You also get a visual presentation, which I already showed you. This is communication and letters, and if there are any letters from hospital, for example, if the patient was in A&E, you'll get the letter here and you can see what happened to them. I find it really helpful and you learn so much. Now let's talk how you do a consultation. When a patient comes, just before you see them, glance through 3 things. The first, just check the letter, what was the recent letter. The second, check what conditions they have, the allergies they have, and then just check their medications, what the regular medications they are on, and then you start consultation. So consultation looks like this. For example, cough type, cough for 4 days, then ask if any chest pain, so no chest pain documented, no SOB, no hemoptysis, and so on. So you rule out red flags and see how the patient is doing now. Then quickly examine. Again, unlike hospital, you don't need to type everything, so you just click here an icon, and that brings everything in terms of the observations. So you just put BP, this, temperature, this, and pulse rate, whatever you have checked, and you just okay, and it automatically comes in there. And then you have to do the plans. The good thing in GPs, you got templates for everything. For example, if I'm going to document the management, for example, in the plan, you just got auto consultation, so it kind of reminds you what things you have done or not. So medications review done, management options discussed, and then just put A, B, C, whatever you have asked, then just amend it. So advised if symptoms do not improve or worsen to return for review, should contact out of hours. for urgent appointment, informed to read the leaflet. So if you have given any medications, if you have prescribed amoxicillin for chest infection, ask them to read the leaflet. And if the patient has not heard about the investigations in 1 month, to chase the GP. The good thing is that everything usually comes in templates and you don't need to write everything. So this is one of the reasons GPs are able to do consultations in 10 minutes. Another example, if the patient has CKD, you just press this and you get the template again. So this again says what you need to do with a patient who you have diagnosed with CKD. You have discussed CKD diagnosis, lifestyle advice, stop smoking, weight and exercise, explain importance of blood pressure, importance of not taking NSAIDs, blah 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 blah. Yeah, let me give you another example. So for example, a patient has red flags like weight loss, blood in stools, etc. So you need to do a 2 weeks referral. So again, that's very simple. Everything has templates again. So you go to referrals, you go to 2 weeks forms, and you'll find a referral for lower GI. And then when you open the document, you'll see like this. So you'll also, the patient is a Mickey Mouse test patient. Every detail will come. You'll just have to click few boxes and just tick, for example, this patient you're referring because of iron deficiency anemia, blah blah blah. And in the end, you have taken consent, yes, no, yeah, and just go. Yeah, that's all done. And it's all processed by the secretaries in the surgery, and you don't need to worry much from there. Now I'll talk about the 3 tabs that you should open while you're seeing patients. The first one is Past Medicine. Get a subscription of Past Medicine. The textbook in the Past Medicine is super helpful. If you don't have time, NICE guidelines are very lengthy and you do need some time to go through them. For example, just open the book and see, for example, a patient has come with fibromyalgia, right? You put fibromyalgia, you'll see what are the things we normally recommend. It's a concise form of NICE guidelines. For example, it says the medications pregabalin, duloxetine, amitriptyline, and you just go here. For example, you want to give amitriptyline, so it will come, you press on this, so that will come like that. For example, if you're starting from 25 milligram tablets, and the good thing is that you have got information about it. So you click this, you get everything about this medication. The BNF opens up here in your system, the dosage, the contraindications, precautions, the warning, everything, so you can see them if you're not familiar with them, and then you can just prescribe. Another important thing is that you can open the BNF, but it's usually in the system one, so you don't really need to deal with that. Another important thing, I would suggest to get a 365 login. So you normally get a free login of Microsoft with your NHS email address, and just check the qualified GPs who are working in your surgery and how they are seeing the patient. So if you've got some free time, go through their appointment list, see how they are clerking, and just copy paste some clerkings here and just go through them in your free time. So that will also help you learn more. So this was kind of a brief overview of this GP workflow, and to be honest, with time you get the hang of it. Before starting GP, I was kind of so overwhelmed. Initially I struggled for a couple of weeks. When I got the hang of the system, it's not very difficult. Having said that, GP is a hard work. You are seeing patients back to back, but don't you think it's more intellectually stimulating because you are constantly using your clinical acumen? In hospital, half of the time you are providing some service, you're doing bloods, and in GP it's more intellectually stimulating. It can become exhausting for you if you do too much, but that's the reason GPs always keep a balance. Normally they work 3 days a week and they do other portfolio stuff, and there are hell lot of opportunities once you CCT. So this was just a brief overview. It's not that bad. If you are really interested in GP, just come have a taster week. And if you want to be a GP and the only thing that's pushing you back is that how are you gonna do things in 10 minutes? So here is how you do things, and once you get the hang of things, it will get, of course, better. Now let me give you some very important tips. Number 1, ask questions. If you're not sure about anything, do ask your supervisor or anyone around. Sometimes you might feel you would sound stupid, but you have to ask questions. There's a saying that he who sweats more in training bleeds less in the battle. So you have to ask questions. Number 2, do not get too much overwhelmed with the time you have got. Initially, in your first rotation, you will start with 30 minutes. It will take some time to get the hang of things, and always make sure you open the tabs that I have mentioned in the video and look at the nice guidelines and stuff around. After some time, they'll put you down to 20 minutes. Some surgeries will take you down to 20 minutes after 6 weeks. Some will take you down in your ST2 and they'll be okay for you to be on 30 minutes for your first 4 months. So it depends. But if you do not feel safe coming down to 20 minutes, tell your supervisor. Everyone has their own timelines. There is no rush. They will support you and it will not have much effect. Number 3, make sure that you have some good support around. GP is a bit isolating as compared to hospital. For me, I had a very good colleague from Nepal. We used to have our breaks together and we used to talk about things and you just build some rapport with your colleagues around. That actually helps. Number 5, get familiar with the portfolio. Portfolio is a monster that has to be fed. So you have to make sure that you give some time to it. Just in your free time, go through 14 fish guidelines and RCGP guidelines. It's very helpful. I might also make some videos about portfolio later on, but make sure that you do not ignore it. And number 6, keep yourself well hydrated, eat well, exercise, go for a run on your off days, keep yourself active and healthy. And yeah, do subscribe to this channel because this channel is also about health, well-being and productivity apart from medical education, and I'll make videos on that as well. So yeah, I hope that helps. Let me know if you've got any questions. You can also DM me on Instagram if you want. You can also ask in the comment section and I would be more than happy to help you. We'll see you in the next video.